Eyes are often called the windows to the soul, but more commonly, they can be a window into your health. Changes in your eyes, such as blurred vision, floaters, and redness, can signal health problems. In today's video, we'll explore the 3 major signs of heart disease that your eyes can reveal, along with 5 other health conditions. Did you know that eyes are the only place in the body where a doctor can see blood vessels, nerves, and connective tissues in real time without an invasive procedure? The arrangement of blood vessels at the back of the eyes is closely linked to the health of your heart. When reduced blood flow caused by heart disease, known as ischemia, leads to inadequate blood flow to the eyes and causes retinal cells to die, it leaves permanent marks. These marks are why ophthalmologists are often the first to identify health problems, including high blood pressure, high cholesterol, stroke, and more. Therefore, it's not an exaggeration to say that a comprehensive eye exam can not only save your vision but also your life. Now, let's move on to number 8, high blood pressure. An ophthalmologist can observe the blood vessels in your eyes using imaging tools and detect signs of hypertension. High blood pressure can cause retinopathy or damage to the main blood supply of the eye. This can lead to blurred vision, eye bleeding, blood clots, swelling, nerve damage, or even a retinal stroke, resulting in total vision loss. To detect high blood pressure, the ophthalmologist will check for changes in the ratio or shape of the retinal vessels or for small blood clots in the eyes. In healthy individuals, the ratio between the size of the retinal arteries and veins should be about 2 to 3. Therefore, if the artery is much smaller than the vein, or if the vein is much larger and dilated, it could indicate high blood pressure or cardiovascular risk factors. Next, we have number 7, blocked arteries. Hypertension is not the only heart-related condition that can be detected in the eyes. During an eye exam, the ophthalmologist can check for an embolus in the eye. An embolus is a blood clot or plaque fragment that acts like a clot. When the clot travels from where it formed to another part of the body, it's called an embolism. An arterial embolism occurs when an embolus moves through the arteries and gets lodged in small vessels or organs, such as the brain or retina. An arterial embolism can be caused by one or more clots. When arterial blockages occur in the brain, it's called a stroke. When they occur near the heart, it's called a heart attack. And when they occur in the eyes, it's called retinal artery occlusion. This condition can lead to the death of nerve cells in the eye, causing or worsening vision loss. Some individuals may regain vision a year after experiencing an eye stroke, but their vision may never fully recover. Older individuals or those with high blood pressure, glaucoma, or diabetes are at higher risk of developing this eye condition. The next on our list, number 6, is high cholesterol. Cholesterol plays an important role in human tissues, but in excess, the wrong type can become a plaque buildup and narrow the arterial walls. The wrong type refers to high levels of oxidized LDL cholesterol, not normal LDL cholesterol. Oxidized cholesterol is what damages artery walls and increases the risk of heart attack and stroke. LDL cholesterol itself is not bad. It's needed to transport fats and cholesterol to parts of the body where they're needed. And guess where oxidized cholesterol comes from? That's right, if you've watched our video on inflammation, you already know that long-term consumption of oxidized vegetable oils and high-fructose corn syrup is one of the main dietary causes. Now, back to our eyes. Through optical coherence tomography, OCT, your ophthalmologist can detect signs of high cholesterol by observing your eyelids, cornea, and retina. There is an eye symptom called xanthelasma, which is commonly linked to high cholesterol. Xanthelasma appears as yellow, fatty deposits of cholesterol on the eyelids or the skin around the eyelids or near the nose. This condition is more common in individuals who are overweight, diabetic, or have high blood pressure. Another condition called arcus senilis can also indicate high cholesterol. Normally, the cornea is a transparent tissue at the front of the eye, but when cholesterol deposits develop, they cause a white or gray ring to appear along the outer edge. It's important to note that not everyone with arcus senilis has high cholesterol. However, if high cholesterol runs in your family, you're more likely to develop this eye condition. Now that we've covered the top 3 cardiovascular symptoms, let's see what else your eyes can reveal about your health. Next on our list is number 5, diabetes. The tiny blood vessels that supply your retina can be a telltale sign of diabetes. What happens is that when these blood vessels are damaged by high blood sugar levels, they can leak blood into the retina and distort vision. Your ophthalmologist can see this during a dilated eye exam. This condition is known as diabetic retinopathy. Early symptoms of diabetic retinopathy include blurred vision, floaters, central vision loss, and dark spots in the visual field. You may have experienced floaters before. These are small specks of dust that seem to move as your eyes move. In reality, they are small clumps of gel or cells inside the vitreous, the clear gel-like fluid that fills the inside of your eye. These spots seem to be in front of your eyes, but they are actually floating inside. Now, if you see floaters in your field of vision, it is usually part of normal aging, unless you have diabetes. What happens during diabetic retinopathy is that the retina develops new blood vessels through a process called neovascularization, and these frequently bleed into the vitreous. If they bleed a little, you may see a few dark spots. If they bleed a lot, they can block all vision. In the worst-case scenario, this can lead to the development of scar tissue in the eye and the detachment of the retina, which can cause blindness. If diabetic retinopathy is suspected to be the cause of your floaters, you should also be alert for other signs of diabetes. These include excessive thirst or hunger, frequent urination, fatigue, recurrent infections, unexplained weight loss, numbness in the hands or feet, and certain skin symptoms, including dark patches on the skin. Fortunately, diabetic retinopathy can be reversed naturally. To see our recommended solution for reversing diabetes and complications like neuropathy and retinopathy, click the link below. Next, we have number 4, brain tumors. When a brain tumor forms and causes swelling and increased pressure in the brain, its impact can be visible at the back of the eye. There may also be pressure on the optic nerve, which your ophthalmologist can detect. Additionally, some people may notice double vision, peripheral vision loss, or a change in the size of the pupil, sometimes on just one side. Coming in at number 3, we have lupus. Lupus is an autoimmune disease, meaning your body's immune system attacks its own tissues and organs. The inflammation caused by lupus can affect many systems in the body, including your joints, skin, kidneys, blood cells, brain, heart, lungs, and your eyes. Lupus can cause changes in the skin around the eyelids, dry eyes, inflammation of the outer white layer of the eyeball, changes in the blood vessels of the retina, and damage to the nerves that control eye movements, affecting vision. Now let's move on to number 2, thyroid disease. If the eyeballs are protruding or bulging from eyelids that seem retracted, an eye specialist may suspect an overactive thyroid gland or hyperthyroidism, often caused by Graves' disease. This condition affects the tissues and muscles around the eyes, and symptoms can also include blurred vision, vision loss, or dry eyes. And, at number 1, we have rheumatoid arthritis. A routine eye exam can also reveal systemic inflammatory diseases that cause arthritis and inflammation in other parts of the body. Patients with dry, red eyes and intense pain may show signs of rheumatoid arthritis. The pain and redness can be symptoms of scleritis, a painful inflammatory condition of the sclera, the white part of the eye. The inflammation can sometimes make the white part of the eye appear purple. The pain of scleritis is usually worse at night and can even extend to the face and jaw. And there you have it. The 3 major signs of heart disease that your eyes reveal and 5 other health conditions. Other signs of health risks that your eyes can show include glaucoma, macular degeneration, cataracts, cognitive decline, liver and lung diseases, as well as multiple sclerosis. As always, this video is for educational purposes and is not medical advice. We're not doctors. If you like this video, give it a like, share it and subscribe, and click the bell icon to never miss a video. And now we want to hear from you. Have you ever experienced any of these eye symptoms? Leave your comments below. We'd love to hear from you.